Hello everyone and welcome to our presentation on the New York Physical Therapy Referral Requirements. My name is Zachary Edgar and my company is called Therapy Comply. Therapy Comply is a membership-based compliance website that specializes in physical, occupational, and speech therapy. We offer monthly live, full-length continuing education courses, guides and sample policies for Medicare, TRICARE, HIPAA, NCCI, OSHA, and other important federal laws, information and updates for most private insurance companies, including Medicare Advantage plans and Medicaid plans. We are working on PT, OT, and SLP compliance guides for all 50 states, along with information on Medicaid, workers' compensation, home health, and pediatric services. And we offer ongoing and comprehensive support for our members, which means that members can email us with any therapy, compliance, or billing questions for no additional cost. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. The law states that physical therapy treatment shall be rendered pursuant to a referral, which may be directive as to treatment by a licensed physician, dentist, podiatrist, nurse practitioner, or midwife, each acting within his or her lawful scope of practice and in accordance with the diagnosis. The exceptions to the referral requirement: physical therapists may engage in the evaluation or prevention of disability, injury, disease, or other condition of health without the need for a referral from a physician, dentist, podiatrist, or nurse practitioner. Physical therapy prevention consists of intervention that provide instruction in self-help skills to individuals or groups to prevent pathology or impairments from progressing into functional limitations or disability, and to promote health, wellness, and fitness. Examples of physical therapy prevention, screening, and activities include identification of the elderly who are at risk for falls, identification of children who may need an examination for scoliosis, or identification of children who may have a developmental delay. Physical therapy prevention that promotes general health, performance, or conditioning in well individuals may include evaluation of movement with suggestions that modify movement patterns to enhance performance, classes for the well elderly to maintain balance skills and coordination, and pre- and postpartum classes to teach relaxation and maintain muscle tone and strength. Physical therapy activities that prevent or minimize the potential of the occurrence or reoccurrence of injury would include post-acute evaluation of movement with suggestions to modify movement patterns to reduce the risk of future injury, exercises for stretching or strengthening to prevent back problems in the absence of acute or recent pathology, workplace evaluation, exercises for stretching, strengthening, endurance, and postural training to prevent job-related disabilities. Physical therapy activities that limit the degree of disability in individuals with chronic or irreversible diseases may include aquatic exercise programs, including cardiovascular conditioning and resistive exercise to maintain flexibility and fitness in individuals with chronic disorders. If the physical therapy service is advertised as beneficial for the alleviation of an existing disability, injury, or disease entity, or is billed to an insurer as a physical therapy treatment, it cannot simultaneously be termed prevention. Physical therapy may be rendered by a licensed physical therapist for 10 visits or 30 days, whichever shall occur first, without a referral, provided that the licensed physical therapist has practiced physical therapy on a full-time basis equivalent to not less than 3 years, or at least 4,320 clock hours of physical therapy practice over a minimum of 36 months, anytime prior to the beginning of such treatment. Additionally, the physical therapist providing treatment without a referral shall advise the patient in writing prior to the beginning of treatment of the possibility that treatment may not be covered by the patient's health care plan or insurer without a referral, and that treatment may be covered expense if rendered pursuant to such referral. This notice of advice shall be provided on a form, a copy of which shall be kept on file by the licensed physical therapist as a patient record, and a copy of which shall be given to the patient. The notice advice form shall include the following information: a statement of such advice and a statement attesting that the patient has read the notice of advice, the date treatment will begin, the patient's name and address, the patient's signature and date the patient signed the form, the treating physical therapist's name and address, and the treating physical therapist's signature and the date the physical therapist signed the form. Thank you for watching this presentation. If you enjoyed it, please like and subscribe, and please visit us at www.therapycomply.com.